Dapagliflozin and cardiovascular outcomes in type 2 diabetes. Definition: the dapagliflozin effect on cardiovascular events, thrombosis, and myocardial infarction. 58 trials evaluate the effects of dapagliflozin on cardiovascular and renal outcomes in a broad population of patients who had or were at risk for atherosclerotic cardiovascular disease.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be explaining how SGLT2 inhibitors work. Now, SGLT2 inhibitors are used in type 2 diabetes to help to reduce the blood sugar levels. They differ slightly from most anti-diabetic drugs, which work by either increasing the insulin in the body or increasing the insulin sensitivity of the cells of the body. And the objective of increasing the insulin or the insulin sensitivity is to get the body to take more glucose out of the blood and to store it in the tissues, and that's how they reduce blood sugar levels. However, in SGLT2 inhibitors, they work slightly differently. They work by causing the kidneys to excrete glucose into the urine. And by excreting glucose into the urine, you reduce the amount of glucose or sugar that's in the blood and the rest of the body.
Application in nursing. The cardiovascular safety profile of dapagliflozin, a selective inhibitor of sodium glucose cotransporter 2 that promotes glucosuria in patients with type 2 diabetes, is indefinite.
Medication used to treat type 2 diabetes. It is a single product containing two different medications, canagliflozin and metformin. Canagliflozin belongs to a group of drugs called sodium glucose cotransporter 2 inhibitors, otherwise known as SGLT2. SGLT2 inhibitors work by allowing the kidneys to get rid of more sugar by dumping it in the urine. Metformin belongs to a group of drugs called biguanides. Biguanides work by reducing the amount of sugar produced by the liver. Together, these medications work to lower blood sugars. This medication comes in a tablet form and is usually taken twice a day with food. Common side effects of this medication may include diarrhea, bloating, frequent urination, and thirst.
Pros and cons. Pros. SGLT inhibitors block the SGLT2 protein involved in 90% of the glucose reabsorbing in the proximal renal tubule, resulting in increased renal glucose excretion and lower blood glucose level. Cons. Calorie loss and body weight, risk of hypoglycemia, osmotic diuresis and blood pressure, urinary tract or genital infections. Visa applied in Ecuador. The vast majority of patients were white, which makes the result difficult to generalize to Black and Hispanic patients. The patients who were enrolled in this trial were specifically at very high cardiovascular risk. Nearly half the patients myocardial infarction, coronary artery disease, previous stroke, and peripheral vascular disease. The analysis showed that 39 patients will need to be treated for 3 years to provide a benefit in these outcomes.
So the heart failure community is delighted to see the results of DAPA-HF. SGLT2 inhibitors had an impact on the incidence of heart failure and the development of heart failure, but DAPA-HF said in patients with established heart failure, I can't say the whole long word, DAPA actually
Conclusion. A patient with type 2 diabetes who had or were at risk for atherosclerosis cardiovascular disease, treatment with Dapagliflozin did not result of higher or lower rate of MACE than placebo, but did result in a lower rate of cardiovascular death or hospitalization for heart failure, and finding that reflects a lower rate of hospitalization for heart failure.
With increasing problems of failure of the pancreatic beta cells superimposed on top of our current treatments are largely concerned with trying to stimulate insulin secretion and improve insulin sensitivity. We can't always succeed with these agents, and indeed nearly half of the patients we have at the current time don't achieve the HbA1 targets we're looking for.